I oversee a part of our business called the Watchman device. And so Watchman it's a device that's placed endovascularly in that area where these blood clots come from when you have atrial fibrillation, this left atrial appendage area. So it's literally a plug that sits at the opening of the appendage and prevents blood clots from going wherever, importantly to the brain. So it's an alternative to blood thinners for patients who are seeking something other than lifelong anticoagulation.
Wow.
I'm seeing a lot of patients in clinic that are leaning toward getting off of their blood thinner, and they're requesting to have the Watchman put in. And it was at one point, we were only putting a Watchman in for patients who essentially were on the blood thinner but had had a major bleed, right? They already had it. They took a big fall, they had a head bleed, and now we're looking, how do we get this patient who cannot be on a blood thinner off of it? And we were looking at the Watchman. Things have changed recently with insurance, and it's much easier now for patients to have access to this as an option. You know, I have patients coming in all the time who are covered. You see that patient walking around, they're just covered in bruises, their arms, their legs. And that's really bothersome for them. They hit a wall, they look at a wall, and they get a cut, right? So the Watchman is changing things drastically right now, and I think in such a great way, because I don't really want to see my patients on blood thinners if they don't have to be, just because of the risk. And Watchman, we're putting these in. It's a very straightforward procedure. There is a time period that they need to remain on their blood thinner, but then they're off of their blood thinner and they're staying on a baby aspirin for life.
Yes, so the phrase we like to say is kind of one time for a lifetime, and it's this idea that you have a one-time procedure. You know, in our clinical trials, the risks associated with the procedure are 0.5%, right? So 0.5% risk of adverse event within the first 7 days after the procedure. And then presumably you're off your blood thinner for the rest of your life. So it's a really nice option in the right patient. And again, if you have atrial fibrillation, you're having difficulty either tolerating the blood thinner, or you just want to look at an alternative to a lifelong blood thinner, a reasonable thing to discuss with your cardiologist.
And the Watchman procedure plugs the appendage, or what is it plugging? The appendage?
Yeah, the appendage. So the appendage is like a kind of a windsock shaped part coming off the left atrium. This literally is a nitinol frame that comes out of a catheter, expands sort of like a circle, right? And has a fabric that sits in and plugs the appendage, and then heals over with normal endothelium. And so it becomes a normal part of your heart, and that whole appendage then is excluded from the rest of the atrium.
And the reduction of stroke risk with that procedure in comparison to blood thinners is comparable?
It's comparable. It's a great question, and we just reported out in the New England Journal a clinical trial called the Option trial. So this is specifically in patients who are undergoing AFib ablation. They were randomized 1-to-1 with a Watchman versus long-term anticoagulation, then followed for 3 years.
Wow.
And the stroke rates were low in both groups, but essentially identical, 1.2, 1.3% at 3 years. And so in head-to-head randomized trial,
it's amazing.
Comparable.
That's amazing. And these were just patients in general. It wasn't patients who had a previous history of bleeding or anything like that. They were just like...
In fact, so these were ablation patients in that trial specifically, and they had to be able to tolerate long-term anticoagulation because there was a 50% chance they were randomized to that arm. So they couldn't be bleeders.
Right.
You know, and then half of them continued anticoagulation, half of them got the Watchman. We're also running a trial that's very similar in sort of scope in an all-comers kind of patient population. So you don't have to be an ablation patient in this trial. It's called Champion AF, and that reads out in the first half of 2026. And we'll see exactly how does this appendage closure device compare to anticoagulation over a 3-year period of time.
Wow. That's amazing stuff. Actually.
So many new things coming for the world of atrial fibrillation, just arrhythmias in general. It's exciting.